Good evening. I hope you all are doing well. We did record the WebEx meeting earlier, and the students that were on can verify that I did try to record it, but it did not record. So I wanted to give you a test review. So I'm going to give you this video of the things that we talked about in the WebEx conference earlier. So I'm going directly by the review that is in the module. So if you'll print that out and study it or make notes on it, I'm going to give you some extra little details. All of these topics that are on the test review on this map will be in some form or fashion on the test, and I'll give you a little more detail on that. Under the first section, diabetes, all of those will be, there's a question related to each one of those medications. Please remember that metformin is still a first-line treatment in diabetes, and it can be used in a 12-year-old. So you'll see that again. There is a question on AGIs, which are older diabetic medications. That would be like Precoce and Glynace. That's the alpha glucosidase inhibitors. The TZDs, diabetes and alcoholism, the types of insulin, those specific types of insulin that are on the test are insulin Lispro, the secretagogues, and 70/30. So be familiar with those specific types of insulin. And then moving over to the gout section, be very familiar with allopurinol. There are no questions about colchicine. And let me verify that real quick. I went through every question on the test to make sure that we didn't leave out any topics. There is a question about probenecid, but no colchicine questions. And then also remember that thiazide diuretics can increase uric acid levels and cause a gout flare-up. Okay, and then moving to the NSAIDs section, there's several questions on first-line therapies with NSAIDs. That would be like first-line with aspirin and NSAIDs. So be familiar with what those are indicated for, what conditions NSAIDs is first-line, what conditions that aspirin may be first-line. Okay. This is on the test map, but be aware that long-term aspirin use can cause erectile dysfunction. And someone earlier said that may not be in the book, but it is on the test. Okay. Hypothyroidism. Be very familiar with the TSH and the T4 normal levels, when it's hypo, when it's hyper. Be familiar with levothyroxine, the side effects, indications, dosages, and when to monitor therapy. And also then, like it says on the sheet, considerations in the elderly. All right, flipping over to the next page, opioids. There's not a lot of questions on opioids, and there's no specific drug questions as far as types of like hydrocodone or anything like that, or it's just about, there's some questions about tolerance and dependence, and then long-term versus short-term use. Migraines, be familiar with the triptans. That would be like Maxalt, Imitrex, that category of medications. When they're contraindicated, when they are recommended, what's first-line treatment in migraines in someone who can't take a triptan. All right. And then the other things that are listed in that category. Prednisone, just be familiar with the things I have on the paper. On the antibiotic section, know all of those medicines that are listed, but also know about metronidazole or Flagyl and cephalosporins. Remember that there's a cross reaction potentially with cephalosporins and penicillins. So if a person is allergic to penicillin, they should not take a cephalosporin. All right, and then no treatment for MRSA. And that would, Bactrim is a lot of time, Bactrim, doxycycline, they're broad spectrum antibiotics that are usually used with MRSA. And then on the last section, contraception, know the things I have listed. Just know that any antibiotic use can decrease the effectiveness of oral contraceptives. And then in the miscellaneous section, scratch out the Zantac side effects. Zantac has been taken off the market, and there are no Prilosec side effects. And long-term stimulant laxatives can cause dependence, know that. And then that's pretty much it. If you have specific questions, you can email them to me. I would really focus, there's a lot of questions on the antibiotics, so make sure you study those, and the NSAIDs and the aspirin. So read up on those sections in your text. Read up on all of these sections in your text. But if you have a specific question about something that you've come across in your discussions or in your readings, please send that to me. I hope this will be helpful to you. The final will close, of course, on Friday evening, and those grades will post as soon as you take the test, and then I'll have final grades posted by Monday, and that will close out the class. So please let me know what I can do to help you. I will be having most of you in some of the classes in the fall, so I'll be seeing you again then. Thank you, and again, just email if you have questions. Thanks. Y'all have a good evening. Bye-bye.